I'm Julie Eggleston, and I'm 70 years old. Until a few years ago, I'd been able to do just about any physical activity I'd undertake. As a child, I began running long distances, and I've always played competitive sports at a very high level. As you can imagine, after more than 50 years of doing this kind of activity and the stress and strain on muscles, everything hurt. It got to a point where I really couldn't even stand comfortably, and I couldn't sit. I'd find myself lying down in bed a lot and taking a lot of over-the-counter pain medications. My husband and I have been also very avid travelers, traveling our entire lives. And it was actually on a trip to Machu Picchu and the Galapagos Islands, with all of the sitting on planes, sitting and waiting in airports, standing in lines, getting on and off buses. I discovered that the first and last steps onto a bus and off a bus were the most painful, and also climbing and hiking. I wasn't about to get to Machu Picchu and not attempt at least a portion of the Inca Trail.
Julie was a wonderful patient of mine. She's a retired nurse, and now she wanted to enjoy the outdoor life because they live part-time in Colorado. But she wasn't able to because she had so much pain. She also did not want to do surgery. Being a retired nurse, she had seen all the post-operative changes and pain that patients had gone through, and she really wanted to avoid that at all costs. Julie wanted to find an alternative to surgery. One of Julie's major goals in life was to go back up to Colorado and be outside and hike and jog on trails. That was her main goal. When I initially saw her, she was unable to do this because of multiple locations of arthritic pain. Julie was looking for one procedure in a few hours where we could work on multiple joints on the same visit and same time and same procedure. I offered her adipose-derived stem cells and recommended this specifically because with adipose tissue, you oftentimes can get more than one joint and work on a few joints at the same visit or procedure.
So in December of 2017, I decided that I would have the stem cells and PRP done to both my knees, my right hip, and my right SI joint. The procedure itself was relatively painless.
6 to 8 weeks after the procedure, Julie called me up and told me she was coming along beautifully. She actually flew down a few months later and thanked me for the fact that she was able to be outside, hike, and be active again in Colorado.
I was pain-free. I could then resume activities that I hadn't been able to do for a while and be active all day long. I've been able to play more sports, be more involved, and actually I never ever dreamed I could get to that level again. In my life now, I have a medical alert service dog, and she does require activity and exercise daily, and I'm able to provide that. It's been more than a year since the procedures were done, and I feel like I'm still getting better. So thank you, Cellaxys, and thank you, Dr. Otten. You've given me my life back.